Hello, this is Dr. Andre Jones with Inspire Dental, and today we're going to touch on the topic of All-on-4. So All-on-4 is full mouth implants, and so we're going to dive into some of the frequently asked questions and kind of describing what exactly is an All-on-4. I hope this video will be very informative and good for you. What exactly is All-on-4 dental implants and how do they work? So what's really cool is a few decades ago, about 34 years ago, a lot of information and research was done on dental implants. And what they were studying was, well, how could we replace someone's missing teeth with implants? How do we replace someone who's missing all their teeth with implants? And that's where All-on-4 started being developed is, do we have to put an implant at every single spot where there's a missing tooth? Or can we space out these implants and create enough stability where we can support a full set of teeth? And what they discovered was that if as long as there's 4 implants, spaced equally apart, that is stable and strong enough to support a full mouth of new teeth. Now, All-on-4 is specifically referencing teeth that are screwed in that never come out. And so, because there's dentures that you would, you can pop into implants and pop out, but All-on-4, these are teeth that are screwed in, and it is a type of denture, and that specific type of denture is called a hybrid overdenture and hybrid implant denture. Now, when you hear about this kind of dentistry, it can seem really hopeful and exciting if you're someone who is either missing a lot of teeth, missing all their teeth, or can kind of see that I'm going to get to a point where I will be missing my teeth. When we look at this, the question that needs to be asked is, well, who is a good candidate for an All-on-4 set of teeth? I would say the best candidates are ones who have lost their teeth due to cavities and wear and broken down teeth, because implant supported teeth cannot decay like our natural teeth can. So our natural teeth can get cavities, even if it has a cap or a crown or a filling, even those, because they're still attached to your natural tooth, can get a decay. Well, an All-on-4 says it's not made of natural teeth, it's based by implants, and the teeth are made of porcelain. Those teeth cannot decay, and so that's why those are the best candidates, people who have lost their teeth through wear, fractures, cavities, things like that. Now, another good set of candidates are people who had trauma or something to where the bone itself is not diseased. If someone has a disease of the bone, it doesn't completely eliminate them from being a candidate, but there's a lot of factors that we have to take a look into. Also, individuals with severe diabetes that's uncontrolled, people who are heavy smokers that don't plan to quit, those would be people who are not the best candidates for this type of dentistry. And also individuals who lost their teeth due to severe periodontal disease, we also find that they're not the best candidates. Now, if there is someone who lost their teeth due to severe periodontal disease, for that person, we just want to get their teeth cleaned up. If we get their teeth cleaned up, get rid of the disease that's there, we know the teeth are still going to be lost, but then we remove the teeth. When we remove the teeth, it's being removed in a healthier environment because things have been cleaned up. And then we're going in, placing implants in a healthy environment. So then our healing and survival of those implants is usually about the same. Most commonly, the age population that is losing their teeth are usually individuals who are more kind of in the senior category, that are a little bit mature in age. Just the wear and tear of life, things breaking down over time. A lot of times you see older individuals losing their teeth. So this type of dentistry, it's good for all ages. There's not an age limitation except for you can actually be too young, but you can never be too old for this type of dentistry. Your body is going to heal. It might take a little bit longer than someone who is younger, but it still is a great option, and I find it's actually really the best option for seniors. As someone gets older, they start to lose some of their faculties, lose some of their ability, some of their dexterity. So having like a denture that you have to take in and out every day, that can be a challenge as someone gets older, especially if you're depending on a caregiver to take care of you and to perform these actions for you. That can be unreliable sometimes. So what's nice about the All-on-4 dentistry is it's screwed in, it does not come out. And so maintenance and cleaning of it is so much easier than a traditional type of denture. Also, it's more comfortable. It feels more like natural teeth. And so because it feels that way, we find that seniors have a much better time being able to tolerate this type of teeth than, say, someone who is wearing a denture. So it is good for all ages, especially those who are in the senior category. So very commonly, people will tell me, well, Dr. Jones, I've been told that I have just too much bone loss. I guess I'm not suitable for implants. Not true. Even if you've experienced lots of bone loss, you could be still suitable. There's been so many advancements in implant technology that our implants are getting smaller. They're getting integrated into the bone better. So because of those realities, people can have a lot of bone loss and still be a good candidate because of the way technology has advanced. In the past, we had to put in larger screws, larger implants. Now that's not the case, and so it is pretty rare actually where we do get a case where we absolutely cannot put an implant in. In most situations, we're able to customize an implant size to fit a person's bone that they have available and still have the same long-term outcome. What exactly does this process involve? So first step is you schedule an appointment with me. To schedule that appointment, you give us a call at 210-734-5092. And when you call and schedule for that consult, you come in, and at your visit, it's going to be about 2 hours long. At that 2 hour visit, what we're looking at is we're taking bone scans. We're taking digital scans of your teeth, your gums. We're also looking at your medical history. We're looking at any diseases, any things like that. And then we're starting to create a plan for you, planning out, where would these implants go? What would this final smile look like? And I want your opinion. I know something like this could be really life-changing for somebody. And that's why we invest the time in you, because when you choose my practice, you're not just investing in your health or your care. We are actually investing in you as well. I'm investing in an outcome. And so I want you to have the best quality of life. And so that's kind of how the first visit goes. Once we have a solid plan in place and we've worked out everything, now we get you scheduled for your actual procedure date. Usually it takes about a 4-week turnaround time to get a person scheduled. The reason for that is because we are creating a design. There are so many factors that have to come into play if we're recreating someone's smile, recreating someone's bite, someone's function, their chewing, their speech. All of those things gets recreated with this. So there's a lot of planning that goes into place. And because this is custom made for you, it's not a one size fits all. That takes a couple of weeks to develop that. After that 4 weeks, you come in during your procedure. We're going to have you go to sleep. The best time to work on somebody is when they're asleep and relaxed. And so this process takes about 4 to 6 hours. Well, I want it to feel like a blink for you. So we have you come in, you go to sleep. I'm working for 4 to 6 hours. You're dreaming and napping. After that 4 to 6 hours, you wake up and you have your new smile. It's pretty spectacular. Now, what the smile that you're left with at that time is actually a temporary smile. And that's what a lot of people don't know. We see lots of commercials and ads on television about this kind of thing. And everyone's like, oh, it's smile in a day. Yes, you leave with your smile in a day. But what you don't know is that smile is temporary, just for a couple months. The reason we do that is because as things heal, gums can shrink, things can shift. So we want everything to heal, because once it's all done and healed, we want to make sure that we have the final placement of your implants, the final position of your gums, and that way those final teeth are a perfect adaptation to your gums, to your implants, towards everything. So that's why there is a temporary stage, because that's where we work out all the adjustments, and then that way when we get to that final stage, no adjustments are needed. You are walking out of here with your beautiful, perfect smile. How long does this procedure take? And I kind of touched on that a little bit in my last question. The whole process takes about 4 to 6 hours. Occasionally, depending on the person, it might take a little bit longer, but I would say kind of plan for a whole day where you're either going to be in the office or just relaxing at home. So now that we know how long the procedure takes, how many exactly visits are there? I would say in most cases, in a 6-month period, it's probably going to be somewhere from 6 to 8 visits, depending on how many adjustments are needed. Like I said, and that's including your very first visit as well. Because there are different checkpoints along the way where I will see you as the patient just to make sure healing is normal. We make any adjustments that are needed. And because ultimately, while you're walking through your temporary stage, we want to make sure that things are healing perfectly and that all the adjustments are being made while you're in your temporary. So when it comes time to making your final teeth, we have the perfect product that you desire and can recreate that for you. And that way, once you get that final product, that's it, you're done. After everything is said and done, we see you back once every 6 months just to make sure that your implants and teeth are being kept clean. An all-on-4 set of teeth, is that a permanent solution for missing teeth? And I would say in most situations, yes. What I always educate my patients on is you get what you buy. There are a lot of places that are trying to cut costs, make this type of dentistry less expensive for people. And that's great because it makes it more accessible. But the issue is when they do that, they are substituting the product. So you're not getting the same product like you would in my practice or some other places. You're getting a lesser product, which means it's cheaper, which means that it is not going to last your lifetime. In my office, when I do this dentistry, it is there to last a person a lifetime. When I say lifetime, that means it's going to outlive you. But there are, depending on the type of implant you get and where you go, I've seen it where things only last like 10 years. You make this investment and you go through all the pain and recovery and everything just for it to last 10 years. Well, that's not worth it to me. That's why where you go is very important. Also knowing the credentials of the doctor. What people don't realize, like for me, I had to attend a residency where I spent a year just learning this. A whole year devoted to this. Whereas there are doctors that can just go and take a course over a weekend for a Friday, Saturday, Sunday, and then can on Monday start doing the same very thing, right? What do you think is better? That's why where you go matters, and the expertise and experience of the doctor also matters. And so when you are going in, interview your doctor. Don't just trust anybody. Interview them, find out their credentials, how many cases they've done, how they manage complications, because there can be. Something that is, to know about like me and my practice, because of I do this type of dentistry and because of the way I was trained, something I'm kind of known for in San Antonio, Texas, is that I'm the guy that fixes things when they go wrong. And so I get lots of cases where things were done by someone who is inexperienced, things were done not really correct, and I have to kind of fix those problems. It's nice is because I am the guy that fixes the problems. I know fully how to avoid those problems. That's what the difference is, because this should be something that lasts you your lifetime. So how long should this last? It should be your lifetime. So what's the difference between full arch implants and all-on-4 procedure? The difference of that, it really comes down to how many implants that were being placed. A full arch implant means you're pretty much replacing every single tooth with an implant. Well, like I was kind of mentioning you to the earlier part of this video, is that's not always necessary. Research shows if you have at least 4 implants, that is enough to stabilize a set of teeth for a person's lifetime. So 1 for every tooth is not necessary. It actually it grows extremely expensive to do it that way. You're talking about like doing a full arch implants is more than double the expense of a all-on-4. On top of that, a full arch of implants, the implants means the implants are closer together, and hygiene is very difficult. So a lot of times we start to see bone loss in full arch cases like that because it's just very difficult and hard to clean. One of the reasons we space implants out for all-on-4 is because we actually want to create space for cleaning. You use a water pick to clean, and so it allows for that water to get underneath and things are not too tight where you can't get the water in to keep things properly cleaned. That is really kind of the difference between full arch implants and all-on-4. So what is the advantage of a all-on-4 implants versus other implant options? And really the advantage is it's really the long-term survival of it, the comfort of it, the natural feel of it. I mean, that's kind of the advantage of it. And really just the timing. You get teeth right away. You can go with dentures that snap in, but because these dentures are snap in and snap out, that force to snap in and out, you don't get teeth right away. So it's really the only option where we can actually replace someone's missing teeth and get them teeth within 24 hours, within that one day. So that's really kind of the advantages of the all-on-4 is the long-term survival of it and just the level of comfort, the natural feel, and really the turnaround in getting teeth. That's the advantage of it. What does an all-on-4 set of teeth look like? Our goal is to replicate a natural set of teeth. So I'm sure you've probably been places where you see these super white, chiclet, artificial looking teeth, right? That's not here. In my office, you're gonna get something that not only feels natural, it's gonna look natural. And because I want to give you a beautiful smile, but I don't want someone to look at you and be like, oh, those are fake, right? Part of this is also not just returning function and improving your health, it's also boosting confidence. That's what it's meant to do. So what's nice is in this process, you get to kind of design this. So that smile you've always dreamed of, that smile you've always wanted, you get to create that. Like that's really cool, that's exciting. So the final result is really a conglomeration of some of my expert opinion and also your own opinion of what you've always wanted and desired for your smile. And like I said, so that end result is that where you are left with a confident smile, confident set of teeth that, like I said, look beautiful, feel beautiful, and also function beautifully as well. So that is kind of what the final look looks like. And like I said, in most situations, when it's done right, people can never even tell that anything was ever done. How will this actually impact my overall health and help my quality of life? Well, if you're someone who hasn't had teeth for a long time or has been missing teeth, how hard has it been chewing? Have you been avoiding foods that you wish you could enjoy? Are you having to cover your face while you're with family while you eat? Are you having to hide your, or cover your smile when you laugh or when you're taking a picture, right? Like, how does that feel when you're in that position? So really, as far as quality of life goes, like I said, that boost of confidence just overall improves mental state. It improves our fellowship, and improves, that in itself improves a quality of life. Then on top of that, when you look at the research on if people are missing a lot of teeth and having to avoid foods, that means we're not being able to eat a balanced whole diet. Well, then that affects our overall health. So when you look on average, people who are missing more than a third of their teeth, on average live 7 years less than the rest of the population. 7 years. That's a long time, 7 years. Well, why is that? It's because if the oral health is deteriorating, well, then that means our overall health is deteriorating. And oftentimes we tend to, people will tend to transition to softer foods. And so a lot of those softer foods contain lots of carbohydrates, things like that, which means it's hard to stay healthy if that's all you're eating. So, not only does it boost the confidence, but it improves someone's overall quality of life by being able to eat better, being able to eat a greater variety, being able to be more comfortable when you eat, and as well as overall getting disease out, right? If someone is at that point where teeth are having to be removed, that means there's disease present. Well, that bacteria and disease is going to, go into your bloodstream. It's going to be swallowed. It's going to be going into your stomach, and it's going to create disease in other places of your body. That's just not my opinion. There's so much research on that. One of the greatest complications of oral disease in the mouth is cardiovascular disease, so disease of the heart, neuro disease, so that's dementia, Alzheimer's, things like that, stroke. So all those things are present when someone has disease in their mouth. So that's why it's so important to get a person's healthy. And that's part of what this option does. It doesn't just remove those decayed teeth, but it actually gives you a solution for replacing those. Lastly, the other way that makes an overall improvement is one of the most common causes of esophageal cancer are individuals who don't have a lot of teeth. Well, how does not having teeth cause esophageal cancer? What happens is when we cannot properly chew our food, then it means we're swallowing larger chunks or whole foods. Well, what a lot of people don't know is the mouth is actually the first step of digestion. In our saliva, there are enzymes that break down our food, that soften it, and really break it as we chew it. So that way when we swallow it, it gets to the stomach, that now they can break it down further to convert it into nutrients. The problem is, if we're not being able to effectively chew our food, our stomach now has to produce more acid to break that food down. What happens is, because it's breaking down more acid, that acid often comes up in the form of like heartburn, and as it gets worse over time, it'll even be vomit. So a lot of people, when they lose their teeth and get older, they will vomit after every meal because they don't have enough teeth to break down their food. Well, because that acid has been coming up, it damages the esophagus. And because it damages the esophagus, it ends up turning into cancer. And that's something that a lot of people don't realize. And so here we get someone who's late in life now developing cancer that easily could have been avoided if their teeth would have been replaced when they were at an earlier stage or younger. And then lastly, when that acid comes up, there is even the possibility where it can go into the lungs. There's a thing called the epiglottis in our throat. The epiglottis closes off our airway whenever we swallow. That's when we're swallowing. So if something is coming up, well, it doesn't work in reverse. So when something comes up, it can easily go into our lungs. When we get stomach acid in the lungs, that now becomes a very medical, life-threatening situation. And most people usually die when that happens. And so we're lucky if we can get to the hospital fast enough. That's why I explained, like, it could be a matter of life and death replacing your teeth. And it is a matter of life and death, not just in the immediate sense, but even long term. Like I said, people who have missing teeth, their life is going to be shortened by at least 7 years. So it is a big difference, and that's kind of how, an all-in-4 type of procedure can actually, get someone healthy, which then in the long run, again, improves their quality of life. Now, I'm not going to pretend that all-in-4 is just this perfect God-given treatment. It is, it's amazing, but just like with any other thing in life, it's man-made, so things can go wrong. I would say the most common complications that we occur is that we have the temporary set of teeth break while you're healing. So you start off with a temporary set of teeth, and that temporary set of teeth, it's temporary. It is actually designed that if something overloads those teeth, that actually it's going to break in order to protect the teeth. That's kind of how that works as you're healing. That's the greatest complication. Well, if that happens, no big deal. You just come in, we unscrew the broken set of teeth, and we make you a new one and give it to you right then. What's cool in my office, we actually make the teeth in-house, so we can get you a set of teeth literally in 30 minutes. So you call us in advance, we fabricate it, you show up, we're just taking out the old one, putting in a new one. So it's a very easy complication to manage. Now the second complication that I would say is also fairly common would be like, healing complications. Well, what creates a healing complication? It's really when people don't follow my instructions that we give. So at first there needs to be a very soft diet. And so that's always the hardest for people, because who wants to be stuck with soft foods? So a lot of times people try to cheat and eat, more firmer foods or meats or things like that while they're going through the healing stages. And then so that can in effect then, delay healing or cause a healing issue. So as long as and then also it's the number one reason why teeth break. So when I talk about, these temporary teeth breaking, usually it means someone was cheating on their diet. So it's really, if you just stick with the hygiene, you stick with the diet, complications are very unlikely, especially with my planning. As I referenced in this video before, like I put a lot of planning into place for this. Because we do all of that planning, it prevents complications. So it is very rare that I actually run into issues because of how much I plan, and I've never had a case where we could not get to the desirable outcome at some point throughout this whole process. So what is the cost of this? Brace yourself. It can be very pricey. It varies in a range. It really depends on, do you have existing implants already? What is your bone level? What type of teeth we want to sell in? So that range can range from either $20,000 all the way up to $50,000. And that's really kind of starting fresh with someone who's never had implants before. So that's kind of the range. Now there's different types of teeth, different materials, there's even a different number of implants. I know we've said all in 4, but there are times where we'll put, 6 implants. It really just depends on the person's bone type and how much bone they have. And so that kind of determines the outcome of the overall cost of it. And like I said, it also determines on what type of teeth we want to go through. Because you remember, you're going to help customizing these teeth. So ultimately, depending on what we settle, and choose upon, so can affect the overall cost. What is the recovery of this type of procedure? And normally in most situations, it's about 3 days. It's 3 days where you're a little bit sore, things are a little bit swollen. After 3 days, that starts to go down. And when that swelling starts to go down, then things are pretty smooth in recovery after that. I would say at most, the soreness can last about 2 weeks, but that doesn't mean you're on pain medicine that entire time. It's usually about the turnaround time as far as initial recovery. What's important when you choose this type of dentistry is knowing the maintenance that is required. So what is required is that you have a water pick and that you use your water pick at least twice a day like you would brush your teeth. Because food can get underneath of there, but it's easily removed and easily washed out with a water pick. In conjunction with your home care, we will see you twice a year in my office to clean your all-in-4. And then once a year, we'll unscrew it, be able to clean the implants underneath of it. We have the special sterilizer that we, as a courtesy, put your teeth in. It sterilizes, cleans the teeth. That way they're good as new. We put them back in and screw it back in, and then you're set for another year. So that's kind of like what the maintenance looks like for an all-in-4. So I hope this video was very informative for you, and I hope it answered a lot of questions you have about this type of dentistry. I hope for many of you it may help you make the decision that this is something you now want to do. I know this step can be intimidating, can be scary. What I tell you is this: we want to walk this journey with you. And we want to, like I said, we want to invest in you, in your life, in your health, so that way you live the best quality of life. The best way to start this is to give us a call. Our office number is 210-734-5092. You also can check us out on our website at inspiredentalsa.com. I look forward to hearing from you. Thank you. Have a good day.